Welcome to another upper cervical chiropractic clinical review. My name is Dr. Chris Brown, and I just had a brain fart for you. Anyways, what I'm going to be going in on today is a patient who was a mom of a 2-month-old at the time, and she was dealing with right rib pain. So, with this new mother, she was dealing with a lot of rib issues that had began about a month prior to her reaching out and starting care. And a lot of it was due to having to hold her toddler like this. She'd pick her up, hold her toddler. She'd have to, do the hunch where she'd balance him on her rib and start twisting and torsioning her body up. And that led to a lot of rib issues that were pretty stabbing in nature, and it prevented her from picking up her kid and being able to actually kind of like do life with him. She wasn't able to pick him up. She wasn't able to carry him around. She had a tough time getting out of bed at times. It turned into like spasms almost. And at that time, she hadn't really done a whole lot for it. She hadn't really tried out. She was trying to see if it would work its way out, but it wasn't working. And she had went to go get just a rib adjustment on that rib, and it made things worse. And so it made her very hesitant to reach out and look into other forms of care. But she ended up giving us a call, and I was just asking some questions. And since her body wasn't really able to respond towards what was going on and it wasn't able to heal itself up, it made me think that maybe there's something neurologic going on that's preventing her body from getting well, because that's the entire point of our body. Is it's a very resilient organism, and it's able to heal itself and regulate itself when in a position to do so. And what coordinates that healing comes from our brain. That's where it originates, and it gets communicated and conveyed through nerves. So that makes brain-body communication of the utmost importance, which is why that transition site from brain to body is incredibly imperative to make sure that it's functioning properly and optimally, which is what we specialize here. And especially with upper cervical chiropractic, we only take care of these top 2 bones of the neck because of that relationship with brain to body and global function of our nervous system, and thus our body. So with her, we were able to get her in and run a scan on her, and her nervous system was in a very stressed state. She was saying that she was having a tough time sleeping, that she was also dealing with some headaches. She would get some dizziness. She'd also have some palpitations, but really her main thing was musculoskeletal. She was having like some palpitations, edema, some heat-cold intolerance, but when looking at her history, it was neck pain, mid-back pain, lower back pain, tailbone pain, rib pain, weird leg pain. But her main thing was just spasming of her rib on her right, and she couldn't really rotate. She couldn't really bend forward. She had a tough time getting out of bed. Just all this movement was so locked up, and she wasn't able to pick her toddler up. She wasn't able to carry her toddler around. Prior, I had said 2 months. She had a 2-year-old, because I started taking care of him too, and I had started taking care of him this past fall when he was 3. So 2-year-old, my mistake. Apologies. It's late in the day, and I've been recording these for a while, so I'm trying to get these knocked out before I move home. Anyways, so she had right rib pain. I have her paperwork up on the computer right there, and she had to rate it out of 10. This was pretty severe, radiating side pain, unable to move any direction, she was locked up, and she had a tough time sitting in this chair right here. I remember doing her consult, and I remember telling her, I was like, you're in the right place, we can help. And I knew that due to the nervous system scans that I took, because the nervous system scans reveal to me as the clinician, is our nervous system in a functioning state or not? And if it is not, then I know that is due to a misalignment of either the first or the second bone of the neck. And I know a process that's going to be able to reveal what that misalignment is to you and how we're going to be able to help. The reason why it's consistently and reproducibly the upper bone of the neck is because these muscles that will hold up the upper bone of the neck and the second bone on the neck are the only muscles in the entire body that have influence over that area of our nervous system, which is called our brainstem. And it is arguably the most imperative part of our entire nervous system, because it is what is regulating all of the output from our brain to our body and all of the output from our body to our brain. It is regulating, controlling everything. It has all of our control centers in there, our digestive centers, our sleep centers, our hormone centers, our mood centers, our cardiorespiratory centers, our vasodilatory centers, our blood flow centers, our immune system centers. It's got everything in there, and all 7 trillion nerves that are originating from our brain have to pass through that top bone of the neck. So that area is the most neurologically impactful region of our body. And if there's any pressure on that area due to a misalignment of either this first or the second bone, then it can cause massive chaotic output, resulting in symptoms down the line. When those symptoms manifest really is different per person. It depends on how much stress is in that person's system. So in our body, we have a stress load and a tolerance to stress. Ideally, we want to have a low stress load and a really high tolerance or really high resiliency. That way, when stressors, everyday stressors come in, they don't cause our body to stress or spaz out. But what can happen is we can get a misalignment of that upper neck, potentially due to either a physical stressor, chemical stressor, or emotional stressor. And when that happens, that essentially will stagnate or limit our body's tolerance to stress and our body's ability to deal with those stressors. So what will happen is, as time goes on, we will start just having a slow creep of symptoms or of stressors. And eventually, once they kind of reach this equal playing field and we get another stressor tacked on, that's when the symptoms start to arise. Symptoms don't necessarily begin right when we have a misalignment of that upper neck. In this lady's history in particular, she fell out of a tree when she was 13. She got bucked off a horse when she was 12. She had a car accident in 2015, a car accident in 2016. She also had an emergency C-section after trying to do a natural birth. So she had all of these stressors, and I don't remember when the first symptom began, but she also has these various symptoms, right? She had dizziness, she had headaches, she had palpitations, edema, that's cardiovascular. She had the dizziness, headaches is neurologic. She had all these musculoskeletal complaints, neck pain, mid-back pain, low back pain, tailbone pain, leg pain. She also had anxiety, depression, mental health. She had heat, cold intolerance, which is endocrine, really a product of our thyroid. She had random unexplained weakness, which is just in general. And so she had all these different symptoms from various organ systems, and yet when care was done, she didn't have any of those. So it goes to show that the nervous system has a very global effect on human body function and symptomatology. So with her, when I was explaining all this to her, connecting the dots, she's like, wow, this makes a ton of sense. And she took some time, thought about it, spoke it over with her spouse, and she was like, hey, I want to get under care. I need to get this resolved. I think this is the right way. And this can have a lot more help and benefits to me than just my rib. So I was like, okay, let's get some x-rays done, full spine scans done. That's part of our exam process. And on x-rays, what we do is we do motion x-rays that really elicit to us the incorrect movement of these 2 bones of the neck that cause the nervous system to have a dysfunctional pattern. So with her, nothing was moving from right to left. So when we did these motion films, when we tilt to the right, I should see this top bone go from left to right. When I tilt to the left, I should see this top bone go from right to left. For the second bone, it goes opposite. So when I tilt my head to the left, it should go from left to right. So like this. When I tilt my head to the right, this bone should go from right to left. So like this. And this bone should also rotate out too. So we should kind of go like this. So when she tilted her head to the right, her second bone was not going from right to left. And when she tilted her head to the left, her top bone wasn't going from right to left. So pretty much both of these were just stuck. And she also had a rotational piece of this second one, like this. and also wasn't translating, it wasn't rotating. And this top bone was pretty much straight on, but it just wasn't moving. It was really tucked under. Her top bone of her neck was very, very close to her skull. So when we are taking these x-rays and we're getting prepared to administer an adjustment, we have to be very diligent on our angles that we're taking to accommodate for anomalies, because no two people's anatomy are the same. And we have to be aware of that, prepare for that, and be able to address how to navigate that differently. So one thing when it comes to rib injuries, I'm gonna go in a little bit on anatomy real quick to try to connect some dots. But our ribs, they wrap around. And same with all of the muscles that are involved in our rib, they wrap around. And so everything is very spirally, very torsion pattern like this. And that starts from it starts from our neck and goes all the way down to our low back. All those muscles are fanning around, kind of spiraling like so. So not a whole lot is going kind of this way. It's all rotational. That's how our ribs move. And if you notice, if I had someone, especially if I had her, try to do some kind of mobility where she was opening up like this, you'd probably find that you're limited based off of how well your head can turn. So if your head can't turn, you probably can't move very well. If your head can turn a lot, you can probably move really well. It's because our head is the main driver of rotation in our entire body, because this top bone of the neck has no checks and balances when it comes to rotation like that. It's responsible for about 80% of rotation in our spine. And so basically the way that this top bone rests on the second bone, it's like skates on ice. It's just free to move around. Now there are some checks and balances with the skull and how these two joints are oriented with anatomy. But for the most part, if I took someone through some kind of mobility and they had reduced mobility, I'd be able to find that in the upper neck. And that was a big case for her, because as time went on, her rib pain started to decrease and eventually went away. She stopped having the spasms. She stopped having these sharp stabbing rib pain. And her body was able to start moving correctly, because all of those ribs have attachments up to the muscles in our neck, and all the rotation in our neck originates from that top bone of the neck. So it's all downstream. Everything operates downstream and has a trickle effect. So a lot of musculoskeletal issues that occur throughout the spine are compensations for something going on in the upper neck, which was a big case for her. She stopped having the spasms. She stopped having the stabbing rib pain. She was able to start picking up her toddler. And then from there, I was able to kind of teach her how to start incorporating functional movement training at home, to where we're able to reinforce that and amplify that and get her to a sturdy place where she could really get back into gardening, get back into running, get back into weightlifting, and get all these things that you kind of lose as a new mom, because you're prioritizing carrying this child around and tending to this child. So that was a big piece for her. I personally would get rib issues too and lower back issues, and found out that the cause of that was in my upper neck. And whenever I get my upper neck checked and potentially adjusted, especially after I end up needing an adjustment, my whole body just moves and glides so much better all the way down to my lower back. And it's been the same and consistent with patients that I've seen here as well. So this is much more of like a musculoskeletal type case: neck pain, mid-back pain, rib pain, lower back pain. If you get those kind of things, especially spasms, that's very indicative of that upper bone being in a very, very stressed state. Please, if you have the opportunity to and the access to it, get your nervous system checked. It is the most important test that any human can possibly get. And I will be saying that until the day I die. Computerized infrared thermography, Titron, get a functional nervous system check, test, done. Best thing that you can do for your health, vitality, and longevity for you and your family. I'm Dr. Chris. Thanks for tuning in.